California's Public Health Department reports just under 90% of San Diego's public school kindergartners last year were fully immunized against serious childhood diseases, including measles and polio. Here to discuss parent concerns, misconceptions, and the risk of vaccines are my guest, Dennis Burton, professor of immunology and microbial science at the Scripps Research Institute, and Dr. Mark Sawyer, a pediatric infectious disease specialist at UC San Diego School of Medicine. Welcome. Now, Dr. Sawyer, you're a member of the American Academy of Pediatrics Committee on Infectious Diseases. What can you tell us about the population of people who choose not to vaccinate their kids?
Well, in general, these are upper middle class people who get on the internet and gather information that way and share that information with their friends and then make a decision about vaccination. And my overall concern is that when they're doing that, they're not getting the complete story.
And Dr. Burton, the State Health Department found the number of California kindergartners who were not fully immunized has actually doubled since 2007, so doubled the number amount who aren't getting fully immunized. What's your reaction to that?
Very worrying. I mean, there is this thing called herd immunity, whereby the less number of people that are immune, the greater the chances of the herd, the collection of people, of becoming infected. So it's a worrying trend.
And you have a specific example of that, correct?
Yeah, well, the trouble with this whole phenomenon is that these people are clustered together in specific schools and playgroups and other places in our community. So the rates are very high in certain areas. And those are the places where outbreaks of disease are going to start. And once they get going, then everybody gets involved. The children of parents who have made no decision about not vaccinating but just happen to be in the same school, and even some people who are vaccinated because the vaccines don't work all the time, so they can still get infections.
Let's talk a little bit about the concerns of parents. California requires at least 5 vaccinations for kindergartners, including many of them that have a series of shots to be fully immunized. Some parents say that's too many vaccines, it compromises the immune system, it's not healthy. Are simultaneous, I'll start with you, vaccines healthy for kids?
Yes, I mean, the study of vaccine safety is now the paramount thing that's looked at before a new vaccine is introduced into the program. And it is true that we give a lot of vaccines, and many more than when you and I were children, but they've been studied individually and they've been studied together. And the capacity of our immune system to respond is incredible. We could probably give 10 times as many vaccines.
And Dr. Burton, I know research and studies from around the world have never linked autism to vaccines. Yet the perception that that's a problem still persists. Why do you think that is?
It's very difficult to understand because the original reports have been completely debunked. The original scientific papers have been retracted.
To be clear, the science papers that are talking about that there were supposed links.
Correct. Mm-hmm. They were originally in The Lancet, a medical journal. They have been retracted, and the individual involved was actually struck off from the UK medical register. So it's being dealt with very effectively, and without doubt, there is no link that has been that there's any scientific evidence for.
And Dr. Sawyer, I know there can be some side effects with vaccinations, autism not being one of them. What are some of the most common and the most severe side effects?
By far the most common side effect from any vaccine, and this applies to adults as well as children, is you get a sore arm at the place where the vaccine was injected. And that's a good thing. It means your immune system is responding. Vaccines can have severe side effects, but they're extremely rare, on the order of 1 in a million. And what's missing in the equation when parents are deciding about the vaccine versus the disease is that the consequences of the disease are much worse than the consequences of vaccine.
And I'll start with you, Dr. Burton, on this one. There's a new state law that requires, Dr. Sawyer, a new state law that requires parents to talk with a health care provider before they exempt out of getting a vaccine. Do you think that'll increase compliance rates?
I do. I think that's a step in the right direction because it's going to get parents good information. Instead of something they just find on the internet, they're going to talk to somebody who's been trained in the area of vaccines and can give them both sides of the story and give them information which they can then use to make an educated decision.
All right. Well, we have a lot more on our website, kpbs.org. Dr. Dennis Burton and Dr. Mark Sawyer, thank you so much.
Thank you.
Thank you.
Pleasure.